Ohio.
Thank you, Madam President. I appreciate the comments of my friend from Georgia, the senator from Georgia, Senator Isaacson. I rise today to speak in support of legislation I've just introduced, and I would like to talk for a moment about that. Madam President, I've held in the last, in my approaching 2.5 years in the United States Senate, I've held some 140 roundtables across my state, from Bryan to St. Clairsville, from Ashtabula to Cincinnati, where I've had the opportunity to listen as healthcare professionals and advocates and patients and their families speak about their circumstances and speak about their struggles. Through these discussions, one thing has become painfully obvious. Healthcare reform must include insurance reform. And health insurance reform must include the option, just the option, of a federally backed health insurance plan. That's why I'm here today, to introduce a resolution along with 26 of my Senate colleagues to express the importance of including a federally backed health insurance plan in health care reform. As we work to reform our health care system, we must protect what works and fix what is broken. It's important that we preserve access to employer-sponsored coverage for those who want to keep their current plan. And that's what President Obama insisted on. You keep, if you're satisfied, you keep what coverage you have. But with more and more Americans losing their jobs, more and more Americans seeing their health insurance scaled back, that it's important that people have access to something else. Americans deserve the chance to go with a private or a federally backed health insurance plan. It's their choice. This choice is good policy. This choice is good common sense. Americans are tired of trying to get health insurance coverage and being turned down because they have a pre-existing condition. They're tired of premiums and deductibles and co-pays that they simply can no longer afford. They're tired of having to fight for every penny when they've paid their insurance premium. Month after month after month, they're tired of having to fight for every penny that the insurer owes them when they try to use their insurance, and waiting all too often months to get their claims paid. They're tired of wondering whether their insurance will pay for them at all to see the specialist they need, to get the medicine they need, or have the operation they need. That's not what insurance should be. And they're tired mostly, Madam President, of the uncertainty surrounding health insurance. If they lose their job, they lose their insurance. If they get sick, they then can't get insurance. If they submit a claim, it may be paid in a month or 3 months or 6 months, or sometimes, even though they're fighting their insurance company and asking and pleading and begging and cajoling, they may not get the claim paid at all. To be meaningful, health care reform must be responsive to all of these shortcomings in our current system. To be responsive, health care reform must address insurance affordability, insurance reliability, and insurance continuity. And to achieve these goals, health care reform must provide Ohioans and every American with more options. People should be able to choose whether to keep the coverage they have or to purchase coverage backed by the federal government. A federally backed plan would provide continuity. It would be available in every part of the country, no matter how rural in western North Carolina or in southeast Ohio. Its benefits would be guaranteed. Its cost shifting would be affordable. No ifs. Its cost sharing would be affordable because of the problems of cost shifting. No ifs, no ands, no buts. A federally backed plan would be an option, but certainly not the only option. Americans who have employer-sponsored coverage, as I will again reiterate, would still have that coverage. Americans who have individual coverage through a private insurer would still have that coverage. A federally backed plan would be an option, not a mandate. Some will choose it, others will not. That's the kind of choice we ask for. One reason such an option is important is because hundreds of thousands of Americans are losing their jobs and have no affordable coverage option. This would give them one. If you've ever tried to purchase affordable coverage in the individual insurance market, and I have, you understand why a federally backed insurance program is so important. If you live in a rural area where quality, affordable coverage is unavailable, you know why a federally backed insurance option is so important. There needs to be an option for people who can't find what they need in the private insurance market, just like Medicare is there for seniors. The federally backed option will give those under 65 and not yet eligible for Medicare a place to turn. The resolution I'm introducing today with literally half of the Democrats in the United States Senate already signed on as co-sponsors. There will be more later. Demonstrates broad support for a federally backed insurance option in health care reform. I'd encourage all of my colleagues to support this resolution. I would add that almost every Democrat, the majority of the committee, a majority of the Health, Education, Labor, Pension Committee are co-sponsors of this bill. That's the committee that will help to write this health insurance bill with the Finance Committee. If consumers have more options, including the option to purchase federally backed coverage designed to provide the three things that matter most: affordability, reliability, and continuity, the three things that too often are absent from private insurance plans, we will have gone a long way towards making the United States health care system work for every American. That's why this resolution matters. That's why the option of a federally backed insurance plan makes so much sense. Thank you, Madam President. I yield the floor.